Being a mother is the hardest job in the world, even in the best of circumstances, but it becomes even more challenging when mom is fighting a health battle.
I started having symptoms of an autoimmune disorder when I was in 4th grade. So I had various different symptoms. I had joint pain and fatigue. I was diagnosed with ankylosing spondylitis, which is an autoimmune disorder. It's a degenerative spine disease. I also was recently diagnosed with rheumatoid arthritis. I've had a couple of surgeries on my spine and on my hip. I'm on various different medications. I've seen so many different specialists, so it's been quite the journey.
But Trisha's journey is especially unique because, in addition to her own health journey, she's also managing the care and treatment of her husband and their kids.
I have 6 children, and all of them have some sort of a chronic illness. 4 of them are diagnosed with the same autoimmune as me, ankylosing spondylitis. They have the juvenile form, so it's called juvenile idiopathic arthritis. We also have other various chronic illnesses in the house. We have migraines and asthma and other various chronic illnesses. So again, a huge journey of finding the right doctors, building those relationships, finding the right medications.
While Trisha's family situation is rare, 65 million Americans are the primary caregiver for an ill or disabled relative. So she offered up her main resource for managing the madness.
One thing that's really helped us tremendously is CVS Health. And CVS Specialty, they have systems in place. They have an app that we use to order our medications. We received monthly calls as well as text messages, and we still receive those to this day, that tell us when our medications are due for refill. And then we found out about auto ship, so we get the monthly auto shipments. So my college-bound daughter has now learned to take over her auto shipments and her prescriptions, as well as my daughter who's in college. All of that combined together, that really is how we stay on top of everything.
Trisha also advises it's important to prioritize mental health during physical health battles.
That's really the takeaway for all of this, is I always talk to my kids about it's okay to not be okay. You really just have to acknowledge it, advocate for yourself, talk to people about it. Don't pretend like everything's okay when it's not, and that's super important. Acknowledge what's going on with your mental health. You're gonna have good days, you're gonna have bad days. Remember though that those days aren't going to last forever. You can live a fulfilling life while you have chronic illness, and so find those things that bring you joy. That's my biggest piece of advice.
Get more info and resources at cvshealth.com.